In this station, we're going to do our trauma assessment. A couple things to talk about first. Remember, you have 10 minutes to complete this station, whereas medical, you have 15. You are to have 2 silent partners or pretend partners that are going to be here to help you. So one of those partners would probably hold C-spine for you. The other one can expose your patient or manage airway stuff for you. You will have a bunch of equipment set out around you. You can strategically place that in certain positions as you like. They're going to be there for visual reminders. Okay, we're not physically going to grab our equipment and actually do the skills to manage this patient. We're just going to talk about it. Okay, but they are there for those visual cues if you need them. When you do your physical assessment, especially on the secondary, when you start talking about DCAT BTLS, I actually want you to tell me what all of that means when you're at the head. So I'm looking at the head for deformities, contusions, abrasions, punctures, burns, tenderness, laceration, and swelling. Once you move down to the neck, and as you go through the body, just say DCAT BTLS of the neck, DCAT BTLS of the chest, DCAT BTLS of the abdomen, and so forth. And of course, each part of the body is going to have some additional things you want to look for. And with that, I believe I'm ready to begin. BSI scene safety. What's my mechanism of injury? Okay, how many patients do I have? One. Just one patient injected. I'm going to call ALS and transport. Let me know when that ambulance gets here. I'm going to have one partner come up, hold C-spine. The other partner is going to go ahead and expose my patient. Okay, and what's my general impression?
You have a male in his mid-20s, about 50 feet from a rollover.
Mid-20s, 50 feet after a rollover. Okay. With my level of consciousness, I'm going to follow AVPU. Is he awake and alert? Does he track me?
He does not.
How about verbal? Sir, wake up.
He does not.
Okay. I'm going to apply some painful stimuli. Does he respond to pain?
He groans.
He groans. So my apparent life threat is that he is responsive only to pain, probably secondary to this vehicle accident. At this time, I'm going to go into my ABCs. So airway. I'm going to have my partner at the head do a modified jaw thrust. We're going to look inside the airway. Do I have any kind of fluid, teeth, obstruction?
You have blood in
I got blood. So I'm going to have my partner go ahead and suction out my airway, no more than 15 seconds. Is it clear?
Yes, it is.
I'm going to take an appropriate size OPA. We're going to insert it. Does he accept?
Yes, he does.
At this time, I'm going to assess my rate, rhythm, quality, and my breathing. What do I have?
You have 6 breaths a minute, shallow.
6 breaths and shallow. That's pretty poor. So I'm going to have my partner start ventilating my patient with a BVM, high flow O2, 15 liters per minute. As he's ventilating the patient, I'm looking for good rise and fall. What do I see?
You see bruising and crepitus on the right side.
So I see the bruising over here on the right side. And of course, I'm going to inspect and palpate as well and auscultate. And as I do that, I'm going to feel the crepitus. And then when I listen to my lung sounds, what do I hear?
You have diminished sounds on the right, unequal rise.
Diminished lung sounds on the right, and I have that unequal rise and fall. Okay, so what I have now is a flail segment. We already are providing positive pressure ventilation, which is our first treatment. Our secondary treatment would be bulky dressing taped from sternum to spine. Okay. As I do that, I'm going to go ahead and reassess. Do I have any kind of improvement on my breathing?
It is improved on the right.
Okay, excellent. At this time, I'm going to go ahead and log roll my patient with the assistance of my imaginary partners. On the head person's count, 1, 2, 3. And we're going to go straight to the back of the airway. So I'm going to inspect and palpate my upper back here. What do I see?
A little bit of bruising on the right side.
A little bit of bruising here on the right. Okay. While I'm here, I'm going to go ahead and assess the rest of my back. So I'm going to feel the back of the head, the neck, the back, the butt, the legs for any kind of life threats or DCAT BTLS. Do I have any other injuries?
There are none.
Okay. We would slide a backboard in. We're going to roll them on the backboard. Of course, everything's on the head person's count. Now we're going to go on to circulation. I'm going to check a radial and a carotid for rate, rhythm, quality. What do I feel?
You have an absent radial and a weak carotid.
I have an absent radial and weak carotid. Okay, what's my skin color, temp, condition?
He's cool, pale, and diaphoretic.
Cool, pale, diaphoretic. And do I have any major bleeding?
There's major bleeding on the right leg.
Okay, right here. I'm going to go ahead and use direct pressure. Does that control it?
It does not.
Okay, I'm going to have my partner put a tourniquet on that leg. Will that control it?
It does.
It does. So at this time, I believe my patient is in shock. We're going to go ahead and treat him for such. We already have him on high flow O2. We'll cover him with a blanket as soon as we're done with our assessment to keep him warm. And we're going to have rapid transport, and he's already in the supine position on our backboard. At this time, I'm going to do a quick rapid assessment. I'm looking for any apparent life threats that I have not already managed. Any apparent life threats of the head?
None.
Any apparent life threats of the neck?
None.
Any apparent life threats of my chest other than this flail segment?
None.
Okay. Any apparent life threats of my abdomen?
None.
Any apparent life threats of my pelvis?
None.
Any apparent life threats of either leg?
None.
Any apparent life threats of either arm?
None.
Okay, and we've already cleared the back. So at this time, my patient's a high priority patient. Again, let me know as soon as my ambulance arrives. While we're on scene, I'm going to try to get a secondary or a sample history. Is anybody available to tell me anything about this patient?
There are none.
There's nobody around. Okay, so we can't get a sample. I'm going to have one partner get a baseline set of vitals for me to include blood pressure, pulse, respiratory rate, rhythm, quality. What do I have?
Blood pressure is 70/40. Pulse is 120, regular and weak. And respirations are ventilated at 10 to 12 minutes.
Okay, is my ambulance here yet?
Ambulance just arrived.
Okay, so we're going to load and we're going to go rapidly to our most appropriate facility, in this case being a level 1 trauma, and we're going to continue our secondary assessment en route. So I'm going to start at the head. I'm going to look for deformities, contusions, abrasions, punctures, burns, tenderness, laceration, and swelling of my head, ears, eyes, nose, mouth. I'm looking for raccoon eyes and battle signs, any fluid from the ears or the nose. Do I have any?
None.
Okay, I'm going to go to the neck looking for DCAT, BTLS, any step-offs, any JVD or tracheal deviation. Do I have any?
None.
I'm going to go to my chest and I'm looking for DCAT, BTLS. I'm inspecting, repalpating, and auscultating. Do I have anything new, and how is my right flail doing?
Still being managed. Minor abrasions on the chest.
Okay, noted. I'm going to go to the abdomen looking for distension, any rigidity, any extra warmth, and of course DCAT, BTLS. Do I have any? I'm going to go to the pelvis. Do I have any DCAT, BTLS?
Scrapes on the hips.
Okay, but it's stable.
Yes.
Okay, I'm going to look at the genitalia for any DCAT, BTLS. Is it intact?
Yes.
I'm going to go to each extremity, checking for DCAT, BTLS. I'm just going to make sure that I'm still managing this bleed appropriately. Anything new?
Nothing. Lacerations to the left.
Okay, I'm going to come down and check PMS real quick. Of course, he's not going to have very good PMS down there. I'm going to check DCAT, BTLS on my arms. And again, trying to attempt to get a full PMS assessment. Anything, any other injuries, and how is PMS?
Minor scrapes on the arms.
Okay,
EMS is absent.
okay, gotcha. And again, we've already cleared the back. So at this time, we're still transporting to the hospital. We're going to reassess every 5 minutes appropriately. And any of those other injuries, the lacerations, abrasions, the secondary injuries, we're going to manage while we're en route. Done.